Hello and welcome. I am Dr. Hayes Anderson. Today, I want to discuss something that might revolutionize how you think about managing your blood pressure: food as medicine. Specifically, I will introduce you to 5 foods that contain bioactive compounds that produce pharmacological effects comparable to prescription blood pressure medications, particularly beta blockers. These foods are not supplements. They are not extracts. They are whole foods you can purchase at any grocery store and incorporate into your daily meals. If you are currently taking blood pressure medications, continue them as prescribed. These foods are not replacements for your medications. Rather, they are powerful complements that enhance your overall cardiovascular health and, with consistent use, may allow your physician to reduce your medication doses. Food. 1. Celery and the powerful 3N-butylphthalide connection. Let me begin with celery, a humble vegetable that contains a remarkable compound called 3N-butylphthalide, abbreviated 3NB. This compound works through a very specific mechanism that we have come to understand only in recent decades. 3NB relaxes the smooth muscle cells that surround your blood vessels, causing vasodilation, the widening of blood vessels. When blood vessels dilate, the pressure inside them decreases. This is the exact mechanism by which calcium channel blocker medications work. Clinical studies using celery juice have demonstrated that consuming fresh celery produces measurable reductions in blood pressure. But here is the critical detail. You need to consume raw celery to obtain the active compound. Cooked celery loses significant amounts of 3NB. The studies showing benefit typically used 4 raw celery stalks consumed daily. 4 stalks is a specific amount. 2 stalks are not as effective. 6 stalks do not provide proportionally greater benefit. 4 stalks represents the dose studied in human trials, so here is my recommendation. Consume 4 raw celery stalks daily. You can eat them plain, dip them in hummus, or include them in a fresh vegetable salad. Consume them as part of your meal, not as a juice. The whole food provides better satiation and includes beneficial fiber. What can you expect? Most people experience measurable reductions in blood pressure within 3 to 4 weeks of consistent celery consumption. The magnitude is typically a 4 to 6 millimeter of mercury reduction in systolic pressure. This might not sound dramatic, but in the clinical literature, every 2 millimeter reduction in systolic pressure produces an approximately 5% reduction in cardiovascular mortality. 4 to 6 millimeters is therefore quite significant. The taste of celery is distinctive, and some people find it challenging. If you find raw celery unpalatable, juicing is an option. Fresh celery juice made from approximately 4 to 5 stalks in a quality juicer provides the active compounds. Consume the juice within 30 minutes of juicing, as 3NB degrades with exposure to air. Food. 2. Fatty fish and the EPA-DHA omega-3 fat mechanism. The second food is fatty fish, particularly species rich in omega-3 polyunsaturated fatty acids, eicosapentaenoic acid and docosahexaenoic acid, abbreviated EPA and DHA. These fatty acids directly affect the cells of your heart, particularly the sinoatrial node, the natural pacemaker of your heart. EPA and DHA increase potassium movement in these cells and improve electrical conductivity. The net result is that your resting heart rate decreases. Why does a lower heart rate matter for blood pressure? Because heart rate and blood pressure are intimately connected. A lower resting heart rate is associated with better cardiovascular health and lower blood pressure. Beta blocker medications work partly by reducing heart rate. Omega-3 fats provide a similar effect through a natural mechanism. The best fish sources are wild salmon, sardines, mackerel, and herring. These species contain EPA and DHA in their natural form, which is more bioavailable than supplement forms. I recommend consuming fatty fish 3 to 4 times per week. Each serving should be approximately 4 to 6 ounces. Research shows that consistent omega-3 consumption produces resting heart rate reductions of 4 to 6 beats per minute. A typical patient on a beta blocker might experience a heart rate reduction from 72 to 68 beats per minute. Equivalent reductions through fish consumption produce a corresponding blood pressure reduction of approximately 5 to 8 millimeters of mercury systolic. Additionally, omega-3 fats reduce inflammation markers and improve endothelial function. They support the integrity of the glycocalyx, that protective layer inside your blood vessels we discussed earlier. They also reduce triglyceride levels, one of the key predictors of cardiovascular risk. One cautionary note: fish farming practices have become increasingly industrialized, and farm-raised fish contain far fewer omega-3 fatty acids compared to wild fish. The fish are fed grain-based diets high in omega-6 polyunsaturated fats, which are pro-inflammatory. When possible, prioritize wild-caught fish. Yes, it is more expensive, but it is also medicine. Treat it as such. Food. 3. Beets and the dietary nitrate to nitric oxide pathway. The third food is beets. Beets contain very high levels of dietary nitrates. When you consume beets, bacteria in your mouth convert the nitrates into nitrite. Nitrite travels to your stomach and blood. In your blood, nitrite is converted to nitric oxide, or NO. Nitric oxide is the master signaling molecule for vasodilation. The blood pressure benefits of beet consumption have been extensively studied. Multiple clinical trials have demonstrated that beet juice consumption produces blood pressure reductions of 5 to 10 millimeters of mercury systolic within hours of consumption. The effect is rapid, developing within 1 to 3 hours. However, there is a crucial timing consideration. Beets are most effective when consumed in the evening, preferably 2 to 3 hours before bedtime. Why the timing matters? Your parasympathetic nervous system, the relaxation system, is dominant in the evening. When you consume beets in the evening, the resulting nitric oxide production occurs in a neurophysiological context that favors vasodilation. Consuming beets in the morning, when your sympathetic nervous system is dominant, produces less dramatic effects. I recommend consuming fresh beet juice made from approximately 2 medium beets every evening. Use a quality juicer to extract fresh juice. Store the juice in a glass container and drink it 2 to 3 hours before bed. Alternatively, you can consume roasted or boiled whole beets, though the juice is more concentrated and more convenient. Most people notice improvements in sleep quality within 1 week of evening beet consumption. They also note more stable blood pressure readings, particularly evening and nighttime readings, which are frequently elevated in people with uncontrolled hypertension. One consideration: beets are relatively high in sugar compared to other vegetables. While the sugar is in the context of whole food with fiber, if you have diabetes or are closely monitoring glucose levels, track your response. Most people with type 2 diabetes tolerate beets well, but individual responses vary. Food. 4. Raw garlic and the allicin to hydrogen sulfide mechanism. The fourth food is raw garlic. Garlic contains a compound called alliin. When you crush or chew raw garlic, an enzyme called alliinase is released and converts alliin to allicin. Allicin is the compound responsible for the characteristic sharp smell of fresh garlic. But allicin does far more than smell. In your digestive system and bloodstream, allicin is converted to hydrogen sulfide, or H2S. Hydrogen sulfide is a gaseous signaling molecule that produces profound vascular effects. H2S directly relaxes vascular smooth muscle, causing vasodilation similar to the effect of nitric oxide. Additionally, H2S improves endothelial function and reduces inflammation in blood vessels. There is a critical timing detail with garlic. To maximize allicin production, you must crush or chew raw garlic thoroughly. Then you must wait approximately 10 minutes before consuming it or cooking it. This 10-minute delay allows the alliin to allicin conversion to occur. If you immediately cook garlic after crushing it, the heat destroys the alliinase enzyme and allicin production is prevented. Here is the protocol. Peel 1 clove of raw garlic. Crush it thoroughly using a garlic press or by chopping it finely. Let the crushed garlic sit in a small bowl for 10 minutes. After 10 minutes, you can consume it. Some people mix it with a small amount of honey to improve the taste. Others add it to a salad or salsa. Others swallow it whole mixed with a small amount of water. Consume 1 clove of raw garlic prepared this way daily. Most people can tolerate this quite well. The breath odor is real, but manageable. If you are bothered by the odor, consume garlic in the evening and drink plenty of water afterward. The blood pressure benefits of garlic are typically modest compared to other foods on this list, a reduction of 2 to 4 millimeters of mercury systolic. But garlic offers additional benefits. It improves lipid profiles, reduces inflammation markers, and has antimicrobial properties. Combined with the other foods on this list, garlic makes a valuable contribution. Food 5. Dark chocolate and the flavonol-cortisol reduction pathway. The fifth and final food is dark chocolate. This is probably the most pleasurable medicine on the list. Dark chocolate contains flavonols, which are polyphenolic compounds with powerful antioxidant and vasodilatory effects. Flavonols directly relax blood vessels and improve endothelial function. Additionally, flavonols modulate stress hormone levels, particularly cortisol. Chronic elevation of cortisol, the stress hormone, contributes to hypertension through multiple mechanisms: sodium retention, sympathetic nervous system activation, and increased arterial stiffness. Flavonols help normalize cortisol levels, particularly the nighttime cortisol nadir, which is important for sleep quality and cardiovascular recovery during sleep. However, there is a critical specification. You must consume dark chocolate with at least 85% cocoa content. Milk chocolate and lower cocoa content dark chocolate contain too much sugar and insufficient flavonols to provide measurable health benefits. The sugar content actually counteracts any beneficial effects. Additionally, timing matters with dark chocolate. Consume it in the afternoon between 2 o'clock and 4 o'clock. Why this timing? Flavonols have mild stimulant properties and can interfere with sleep if consumed in the evening. Consuming it in the afternoon provides the cardiovascular benefits without disrupting sleep. The recommended amount is approximately 1 ounce, or about 30 grams, of 85% or darker chocolate daily. This is roughly equivalent to 5 to 6 squares of a typical dark chocolate bar. This amount provides 20 to 30 milligrams of flavonols. Most people find consuming dark chocolate a delight rather than a burden. The blood pressure benefits are typically a reduction of 3 to 5 millimeters of mercury systolic. Additionally, dark chocolate consumption is associated with improvements in mood and cognitive function, benefits beyond cardiovascular health. Bob's story: breaking free from beta blocker side effects. I want to share the case of Bob, a 68-year-old patient who came to see me complaining of fatigue and sexual dysfunction. He had been on a beta blocker medication for 12 years to manage his blood pressure. The beta blocker had controlled his pressure effectively, but the side effects had significantly impacted his quality of life. Bob reported feeling perpetually tired. He napped daily despite sleeping 8 hours at night. His sexual function had declined dramatically, a not uncommon side effect of beta blockers that is often under-discussed. His cardiologist acknowledged the side effects, but felt the blood pressure control justified continuing the medication. I proposed an experiment. I asked Bob to commit to incorporating all 5 of these foods into his daily diet for 12 weeks while maintaining his medication. Here was the protocol: 4 raw celery stalks daily, fatty fish 3 times per week, beet juice every evening, 1 crushed garlic clove daily prepared with the 10-minute rule, and 1 ounce of dark chocolate in the afternoon. Bob implemented this consistently. At his 12-week follow-up, his home blood pressure readings had improved significantly. His systolic pressure had dropped from an average of 145 to 135. His diastolic pressure had dropped from 90 to 85. These improvements were substantial. His cardiologist reviewed the data and felt comfortable reducing his beta blocker dose by 30%. Bob reported feeling noticeably more energetic. He reported that his sexual function had improved substantially, though not completely normalized. 6 months later, with continued adherence to the food protocol and further dose reduction of his beta blocker, Bob's blood pressure remained excellent. His energy levels continued to improve. His sexual function further normalized. Bob felt that he had reclaimed his life. He told me these foods had given him back his quality of life while allowing him to maintain excellent cardiovascular health. How to implement these foods. A practical daily framework. Let me provide a practical daily implementation plan that makes this sustainable and convenient. Breakfast. Include your 4 raw celery stalks. You might eat them as part of a vegetable-based breakfast with healthy fats and protein, or consume them as a snack between breakfast and lunch or dinner. Consume fatty fish 3 times per week. Plan these meals in advance. Cook salmon or sardines with olive oil, lemon, and herbs. Frozen wild fish is convenient and maintains the nutritional quality. Afternoon, 2 to 4 o'clock. Consume 1 ounce of dark chocolate with at least 85% cocoa. Savor it slowly. This is a pleasant midday break. Evening. Prepare fresh beet juice from 2 medium beets. Consume it 2 to 3 hours before bed. Prepare the raw garlic clove using the 10-minute crushing rule. Consume it with your evening meal or mixed into a small amount of applesauce. This framework is entirely sustainable. These are not exotic foods. They are all available at any grocery store. They are affordable. This is food as medicine in the most practical sense. Track your blood pressure daily using a reliable home monitor. Most people begin to notice improvements within 2 to 3 weeks of consistent implementation. Within 8 to 12 weeks, the blood pressure reductions are typically substantial. Important cautions about beta blocker. Withdrawal and medication changes. I want to emphasize something critical. If you are currently taking beta blockers, do not suddenly stop them. Abrupt beta blocker withdrawal can cause rebound hypertension, where your blood pressure spikes dangerously high. Never stop your medications without medical supervision. The correct approach is to work with your physician. Show your physician your improved blood pressure readings achieved through dietary modifications. Your physician can then gradually reduce your medication doses as your dietary changes stabilize your pressure. This process typically takes weeks to months. If your physician is resistant to medication reduction, provide them with the clinical evidence supporting these foods. Bring published research. Some physicians are unaware of the strength of the evidence. Education can change their perspective. Food as medicine, your path forward. These 5 foods represent food as genuine pharmacological intervention. They are not supplements. They are not extracts. They are whole foods that contain bioactive compounds that produce real, measurable, documented effects on your cardiovascular system. In many cases, their effects rival or exceed those of pharmaceutical medications. The advantages of using food as medicine are numerous. These foods have no negative side effects. They provide complete nutritional value. They are affordable. They are accessible to everyone. They work synergistically when consumed together, providing combined benefits greater than any single food alone. Starting today, I encourage you to implement this protocol. Begin with all 5 foods simultaneously, or phase them in over a week or 2 if you prefer a more gradual approach. Give yourself at least 8 weeks of consistent practice before assessing results. Track your blood pressure daily. Share this information with friends and family members struggling with blood pressure. These are powerful tools available to everyone. If you found this video valuable, please subscribe to the channel and leave a comment below sharing which of these foods you are most excited to try. Your body is an extraordinarily sophisticated healing machine. Give it the right inputs, whole foods, consistent practice, and patience. Your body will respond with improvement that may exceed your expectations. I am Dr. Hayes Anderson. Thank you for watching. I will see you next time. Synergistic effects. Why these 5 foods work better together than separately. You may have noticed that each of these 5 foods works through a somewhat different mechanism. Celery works through direct vasodilation via 3NB. Fish works through heart rate reduction via EPA and DHA. Beets work through nitric oxide production. Garlic works through hydrogen sulfide production. Dark chocolate works through flavonol-mediated effects. When you consume all 5 daily, you are activating multiple complementary pathways simultaneously. Your blood vessels are being dilated from multiple directions. Your heart rate is being lowered, your endothelial function is being improved, your inflammation is being reduced, your stress hormones are being normalized. The combined effect is far greater than any single food could produce. This is what is meant by synergy. 1 + 1 + 1 + 1 + 1 does not equal 5. It equals maybe 8 or 9 because of the overlapping and reinforcing effects. Additionally, these foods work through completely different biochemical mechanisms, which means there is no tolerance or adaptation. Your body does not become accustomed to their effects the way it can with medications. You will continue to receive full benefit months and years into consistent consumption. This is the beauty of using whole foods as medicine. Shopping guide and practical sourcing tips. Here is your practical shopping list for implementing this protocol. Celery. Buy fresh bunches from the produce section. They keep in the refrigerator for up to 2 weeks in a plastic bag. Buy organic when possible to reduce pesticide residue. Fatty fish. Look for wild-caught salmon, sardines, or mackerel. Check labels. Wild-caught costs more but is worth it. Frozen wild fish is excellent and costs less than fresh. Buy individually wrapped portions and store in your freezer. Beets. Buy fresh beets with intact skin and greens still attached if possible, indicating freshness. You can also buy pre-roasted beets in vacuum packages, which are convenient. Alternatively, canned beets work fine if you rinse them well. Garlic. Buy whole garlic bulbs from the produce section. Each bulb contains 8 to 12 cloves. Store in a cool, dark place. A single bulb lasts about 3 weeks. Never buy minced garlic from a jar. It has lost most of its active compounds. Dark chocolate. Look for brands labeled 85% cacao or higher. Quality brands include Lindt, Ghirardelli, and Toblerone. The darker the chocolate, the less sugar and the more beneficial compounds. Store in a cool place away from direct sunlight. These 5 items, celery, wild fish, beets, garlic, and dark chocolate, should become staples in your diet. They are not exotic or expensive. Every grocery store carries them. Start shopping for and preparing these foods this week.